Right. Hello, everyone. Looks like almost everyone is connected to audio. Welcome, welcome. It's our 12th and final session for the Northeast. I cannot believe we've made it through all 12, a full year of these CPI sessions. So thank you to those of you who've been coming for a while now and joining us, and welcome to any newcomers. To this session is only an hour, but it is jam-packed with funding information. So we are doing everything funding related, and it's really the goal here is to do a little tiny bit of presentation, but mostly this is your time to ask questions. I see we have Ashley Peel from Partnership here. We also have two peer organizations that are going to talk with you to share their experiences with applying for and receiving different types of funding. So got a lot of goodness today. So let me go ahead and go to the next slide, please. We are recording per usual, so if you want to share this with anybody later on or go back to it, you can do that. And I will pass over to, let's see. Actually, no, I'm sorry. So quick overview of the welcome. So if you can update your Zoom name just to include your organization so that we know where folks are coming from. And then we always like to get things started with a little icebreaker. So put in the chat what intention, and this could be personal or professional, but what intention are you bringing into the new year? It might be a goal, but I like to think of things in terms of more just what are we hoping to bring in? What intentions do you have? And please, this is meant to be a dynamic session with lots of Q&A, lots of questions. And so please use the chat or raise your hand or just speak over. This is really your time to get your questions answered. All right, and with that, I will pass over to Eva, who's going to walk us through our objectives and agenda for today, and then we will jump right in.
Thanks, Gabrielle. So just to briefly review the objectives for today, one is that after the session, participants of the session will have a better understanding of available funding sources for building capacity and infrastructure to deliver both ECM and CS services. That folks will have a chance to learn from peers who have applied for and received funding. And also it'll be an opportunity for everyone to get answers about the funding process from peer organizations and Partnership Health Plan of California. So just to kind of review the agenda for today, we just did our welcome, or in the process of doing our welcome. We'll move into funding opportunities, where we'll do a funding overview and have some spotlights from peer stakeholders about their experiences with IPP and Cited and the TA marketplace. And then we'll move into some exciting next steps as we talk about what's in store for CPI in 2024. And then also just a reminder to fill out the participant experience survey from DHCS. You have until December 31st to do so, and it takes about 15 minutes to complete. The link is attached here and will also be included in the follow-up email as well. And I will pass it over to Gabrielle.
All right, thank you. So before we hand it over to your peer organizations to share their experience, we thought we'd do a very quick overview of what the different kind of funding, what the different available funding looks like. So let's go next slide, please, Eva. So very quick overview. We'll go next slide. So I know it gets kind of confusing that there's so many different types. But in essence, there's PATH funding. So these are funding streams from DHCS. So there's PATH funding, which is direct to the community-based organizations, direct to ECM and CS providers. So it's not going through the health plan. And with that, there's really three things that you can apply for. Now, I will say the justice involved capacity building one, which is really specific around building out capacity and particularly IT systems. to get people through the Medi-Cal application process before they're released. That, unfortunately, the third round just closed this summer. So I wanted to put that on the slide, but it's unfortunately not available anymore. But so the two that we're going to really focus on today are two types of PATH funding. One is cited grants, and that's really all around building infrastructure and building
CalAIM
capacity in your
community support.
organization in order to provide ECM and CS services. And that is something that you really work, and Gavin will talk more to this, but you can really kind of shape what it is that your organization needs and then apply for a grant that's specific to those needs. TA Marketplace is also still available. And those are consultants that can provide all kinds of different support, both with the contracting process itself. So if you're not yet an ECM or CS provider, but they can also provide support with implementation. And Andrea and Toby are gonna tell us more about that. Just wanted to note, you also may have heard of IPP funding. That's funding that DHCS sends to the Medi-Cal health plans, and then the health plans decide how to disperse that. Unfortunately, in the Northeast, that funding is no longer available. So we're not going to talk too much about IPP funding today. We're just really going to focus on cited and TA Marketplace. And let's go to the next slide, please. So again, cited is really around, building up that infrastructure. The lovely thing with the TA Marketplace is that you can build something that's specific to your organization, but there's also a bunch of what they call off-the-shelf options. And so we've linked that here. Each of these all have links, and we'll send the slide deck out to you afterward. In addition to the links that are in that turquoise color, I also want to highlight, though, that thing at the bottom that says helpful resource funding cheat sheet. This is something that Alexis from the Health Begins team put together for us and is going to walk us through really briefly. But it's a really helpful checklist so that as you are going through and trying to think about, well, what funding might fit our organization, what's available to us, what do we meet the eligibility criteria for? We developed this cheat sheet to try to help guide you in identifying what the right available funding stream might be for you. So with that, I'm going to pass it over to Alexis to briefly walk us through this cheat sheet. Again, this will be available in the slide deck, and we'll send it out after the meeting as a resource for you to have. Please feel free to distribute it widely. And with that, I will pass over to Alexis.
Hey everyone, is it okay if I screen share from my computer just for this part?
Yeah.
Perfecto. Thank you so much. So what I am going to do, everyone, is actually just go ahead and screen share the funding worksheet that we just developed and provide a little background as to why we developed this. Here we are. All right, and can everyone see my screen? Does it say Medi-Cal Transformation Funding Worksheet?
Yes.
Perfect. All right. So essentially, DHCS understands that with the implementation of community supports and enhanced care management, that there is a lot of infrastructure and capacity that needs to be built just in order to implement these services, these programs that providers have historic experience in being able to render, but have not yet contracted within the context of the Medi-Cal landscape to be able to render. That means that there is a massive transformation that takes place just for these provider organizations to participate in this initiative. So to meet the needs of building capacity and building infrastructure, as Gabrielle already mentioned, there are a number of funding opportunities that are available. Some have been available for well over a year now, but what our polling within the collaborative is telling us is that there are still so many organizations that have not tapped into this funding. It's there, it's available, but there's something very intimidating about the process that's been dissuading to organizations to really tap into these very useful funds. So what we're hoping for is to really take the, or to demystify, to take the headache and complexity out of understanding what these funding streams are by really just translating this into a very simple Medi-Cal transformation or CalAIM funding worksheet. So at the top, you're going to see that you have your first step, which is just to review the funding opportunities at a very high level. So we've included cited IPP and the TA marketplace. As Gabrielle mentioned, the just as involved funding just ran out with round 3. So we didn't include that, but we did include funding that's also available outside of PATH, which is the DXF pot of money as well. So in addition to using the DHCS language in this funding worksheet, we also decided to include a very brief blurb that says, in layman's terms, this is what this funding means. This is what you can use this for. So after you know like what these funding opportunities are, then you can progress with your team to step 2, which is eligibility. So we've included all of the organization types that are eligible to use these funds for TAM, IPP, cited in DXF, and we've given you a little bit of a description to let you know also which organizations qualify for multiple sources of funding. So all you have to do is find yourself in this matrix, and then you'll see, okay, wow, we qualify for TAM, IPP, cited, and DXF, or we qualify for DXF, or we qualify for cited and TAM, so on and so forth. And although IPP won't be available in the North, some of your organizations might be providing services in numerous regions. So you can still look into IPP in those other counties that you operate in. After you determine your eligibility, which funding sources you qualify for, you're then going to go into the allowable uses section. So we literally just wrote down all of the allowable uses of those funding opportunities. And on the right-hand side, you'll just circle, do we need this? Do we need this? Do we not need this? Do we need support with referrals systems? Do we need support with building workforce? So on and so forth. So you'll just literally go line by line, circle what you need, what you don't need. So that way, after you review all of those allowable uses for cited, DXF, TA Marketplace, and IPP, then you can go into step 4, which are the links to apply. So after you see what you're eligible for, what it can be used for, we've included the links for you to just directly apply to those funding opportunities, and also included the application windows on this worksheet. And importantly, the DXF funding opportunity does expire on Wednesday for this round. I'm not certain at this moment if more funding opportunities are going to be available under DXF. So please just review the eligible organizations, the ways that you can use those funds, and then make a decision as to whether or not your organization wants to apply. And something that we at, our organization Health Begins has done on tight timelines for quick application windows is just divvied up the work. Like, hey, you take this page, you take this page, I'll take this page, and just, knock the application out. So we just wanted to provide this worksheet with you because we've seen a lot of dissuasion from organizations tapping into these funding opportunities because sometimes it just feels a little bit overwhelming, but you deserve and need those funds to be able to really build capacity and infrastructure to support CalAIM. So that's in the chat for everyone to review. And as a part of the slide deck, we've also included DHCS's cheat sheet, where it just gives you a much broader, more high-level overview of the funding opportunities.
Great, thank you, Alexis. And just thank you, that was really helpful. A couple of so DXF, for those who are not familiar with that particular piece in the alphabet soup, is additional funding that is really around data infrastructure and the data information exchange that many of you will be participating in. And so if you have questions around that, let us know, but that's what that is about. And again, we're going to send all of this out to you. The other thing is, Ashley just let me know that we now do have a date for the round 3 of cited funding, which is that round 3 will open January 15th. So I just put the link in the chat. So definitely go ahead and check that out. Wonderful. All right. Thank you, Alexis, for that overview. I think now we will hop into our first peer presenter. Gavin Ward is joining us from 24-Hour Home Care and is going to share with us his agency's experience with cited and IPP funding. So Gavin, I will pass over to you.
All right, thank you. And thanks everybody for the opportunity to share about my experience. I think the big thing I just want to share with y'all is don't let these applications intimidate you or maybe have the feeling like, oh, it's not worth my time, I'm too busy. I think that's what I've heard from some of my colleagues and folks I've known. I've been doing in-home care for 20 years, and some of the folks are just so busy and they feel like it's not going to be worth it, or they have to focus on their core responsibilities. So I'm going to talk through our experience and why I really want to encourage you guys not to let that be any type of rationale for you not to look into and hopefully complete whether IPP or path-sided applications. So for those of you that don't know us, we've been around about 16 years, as you can see here, and we became a CalAIM provider technically in 2021 when we started contracting with health plans. But as you guys know, community supports, we do two, personal care, homemaker as one, and respite as the other, didn't really start technically until 2022. So we're fortunate when CalAIM came around, we had already been working pretty much throughout the state, mostly because of our relationship with California's regional center system. For those of you that don't know, the regional center system is regulated by DDS, and it really focuses on individuals diagnosed prior to the age 18 who have a developmental disability. So because of our infrastructure, CalAIM was a natural fit. And the two community supports, again, was a great transition for us. So if we can go to the next slide, Gabrielle. All right, so let's talk about both PATH and a couple of rounds in our experience, and then we'll get to IPP as well. So we have had experience working both in round 1 and round 2. And if you look on the right-hand side of this slide, I'm very fortunate. I work for a regional organization that does have a pretty strong infrastructure of folks on the finance side who have experience applying for grants and kind of figuring out how to navigate the applications. So you can see on the right-hand side, our VP of Finance was kind of the brains and the vision alongside our VP, who I report up to on the strategy side. And so we were able to work with them, and we had a financial analyst who really did most of the work. And he consulted with the different departments, and we set many deadlines. So rather than just having the deadline of when the application was due, we would have many deadlines of how to get feedback by X time from this department and that department. So we were able to chip away at the applications. And according to our VP of Finance, these applications are not nearly as difficult as some of the other things that he's been involved with hospitals and larger organizations trying to get government funding. So even though it will take you some time to complete these applications, we do think it's not as bad as you may think, and to invest the time and effort. Now, if you don't have the bandwidth or the expertise, we are aware of organizations out there, consulting organizations that will help you on a project basis. So even though, let's say, it might cost a few $1,000s to bring in a consultant to help get that application out, we would really encourage you to consider it, because on our end, the amount of time and effort when we look at salaries that our VP has been involved with, or our analyst, versus the return on investment of the grants, it is well worth the time and effort to do this. So you can see in round 1, we were fortunate to receive some funding. And in our applications, we really tied our goals around what DHCS and the health plan that the application was with, what they're looking to do. So for round 1, you can see we received funding to build out technology and infrastructure to really do claims and billing, which was great. We didn't necessarily expect this money to be an option for us, but now that we had it, we're able to really scale a little bit more in our ability to help health plans. And just like with the rest of you guys, we don't know, we're new to DHCS and new to the Medi-Cal world. So some of these contracts we received, some of the lingo, we didn't really know how to interpret it. Fortunately, some of this funding can actually reimburse us for some legal costs, which have been really great. Jumping down to round 2, one of the really neat things, and some of you are probably already familiar with this or doing this yourselves, but this is amazing. I had no idea this existed. Tax dollars can be used through, basically, that's how this money's, ultimately coming back to us to help fund our staffing costs for CalAIM services, whether it's new staff or pre-existing staff that's being repurposed to go from maybe regional center work or private pay home care over to community supports in CalAIM, working with partnership and other health plans. So for round 2, we used a lot of the funding for that purpose. And then shifting over to IPP funding, you guys know this, whether in the Northeast or throughout the state, Californians speak so many different languages, and not just in the Northeast, but throughout, there's a lot of threshold languages that we have to deal with. So we've been able to use some of this funding from IPP specifically to translate our onboarding documents for both members and their caregivers, as you can see again, into 13 different languages. So we are in process with the translation project, and this is really going to help align with the goal of CalAIM to really have access and equity for care. And so we kept our applications pretty clear, concise, and compelling. We didn't make it too long, didn't make it too short. And we've been fortunate to have some success. Next slide, please, Gabrielle. All right. So again, just last slide for me, and I'm available to you guys as well. I'll put my information in the chat to try to be available to answer any questions. But again, if your internal team is just, too busy or doesn't have the expertise, I encourage you guys to consider finding someone that can help you and invest the time, the money, the effort. I do think you'll get it back as long as you meet those applications. And then again, make sure you know your MCP's goal, or the MCP's goal or goals. Ultimately, they're going to be reviewing the applications and making the decision on funding. So I encourage you guys to align with their goals and make sure the funding you're asking for aligns with what they're hoping to accomplish. You guys, many of you are familiar with the 3 C's, clear, concise, compelling. And again, whether you're a one-person CBO or a few hundred, like 24-hour home care, this is an awesome opportunity to really kind of be some fuel to scale services that in my 20 years doing home care, I've never had this opportunity before. And it's been really neat to see the results. So I think that's it. And again, I'll be available for any questions.
Great. Thank you so much, Gavin. It's really helpful to hear a real life example of somebody who successfully applied for, got this funding, and kind of how you used it. I'm wondering if the folks have questions. I see Doug, we have a quick question from Doug. You want to start us off?
Yeah, thank you. Sorry, I tried putting it in chat, but I direct messaged somebody on accident. So we're a practice, but we work with vendors, and we've worked with something similar to what he's doing with caregiving, where our caregiver organization that we work aligned with would go out and do the at-home visits several times a week. But then we were also connecting all those patients with our provider network. So if that caregiver needed to bring a tablet out there to do a telehealth visit, then she would. If that person had hypertension and they were making sure that they took their medications and taking their blood pressure every day, we were monitoring the blood pressure with our RPM program. So we need, we don't have the team that he has or anything like that. And we haven't applied for any grants or anything like that, but we were looking to, join CalAIM and put something together and register ourselves as an ECM.
Great. Yeah. And I'm wondering if actually when we talk about TA Marketplace, whether that might be the better spot in terms of getting some help with contracting. But Gavin, I'm wondering if you have any thoughts for Doug.
Yeah, I mean, to my knowledge, and I don't know if is anyone from Partnership Health Plan here in the room
we
today?
have Ashley.
Okay.
Field.
Yeah, so I don't want to speak on behalf of Ashley. She might be able to respond to this. But last I heard, the health plans in general were definitely looking for more ECM support. I don't know if that's still the case, Ashley. I'm not an expert there, but I can tell you, Doug, if you do, if you are looking to do that and need some support, definitely look into the IPP and PATH-sided funds to assist you. And feel free to reach out to me if you have any more specific questions on the grants themselves. And again, Ashley didn't mean to speak on behalf of Partnership, just sharing some general info.
No, thank you, Gavin. I appreciate it. Doug, yeah, if you are interested in contracting for ECM with Partnership, we ask that all interested providers just complete a readiness questionnaire. It's a simple, I think 2 or 3 page document, just lets us know a little bit more about your organization, which counties you're located in, which populations of focus you would be interested in serving. And then we can either reach out directly to you and set up a meeting if we need more information, or then you go through the contracting piece. So I will put my email in the chat and you can reach out to me.
I appreciate it. Yeah. We did our pilot program in Temecula, California, and Murrieta, and our we're a specialty network. So we had urgent cares and stuff like that in some of our professional buildings that we could, use to help with these efforts, because you never the thing with our system here in California or anywhere in the world, I guess, but you can go to any hospital or emergency room if it's a trauma center, but you can't go to any urgent care. And so we tried to align our urgent cares with urgent needs for our patients to curtail the hospital and ER admission aspect of it. And that's what brought that program really, what made that program work really well. So if we went up into like Redding and up in Northern California, we don't have those urgent cares. We would have to obtain those contracts and stuff like that with our provider networks.
Great. Yeah. Thank you very much, Doug. Do anybody else have questions about cited grants? In particular, if you've considered applying for a cited grant but haven't yet. Curious to know what your experience has been and kind of what some of those barriers are. We can also circle back for more questions as well. All right. Well, if you think of anything, please, I see that Gavin has put his contact info in the chat, and Ashley has put hers and partnerships as well. So feel free to reach out to them. And again, if you think of any other questions, we have plenty of time. So raise your hand or put them in the chat. We'll make sure to get them answered. All right. So with that, I think we will pass over to Visions of the Cross, who's our second peer presenter. We've got Andrea Edwards and Toby Crum with us today. They're going to give us a little bit of background and then again be mostly available for Q&A. So thank you.
Yeah, thank you, Gabrielle, and thank you, Health Begins, for having us again. It's always a pleasure to speak about our TA experience. So just a little bit of an overview. We're a drug and alcohol recovery center offering residential and outpatient recovery programs in the Northeast here. We are also an ECM and community supports provider and a recipient of PATH cited round 2 and 4 TA marketplace applications. So next slide, please. So for our CS project here, we're focusing on, just to go back a little bit, our TA vendor for our ECM and community supports is going to be Innovation Horizons and Health Policy Matters, and they're helping us on our CS, which is our social determinants of health, where to go next, and our ECM evaluate our client outcomes. We also have applied for through USC, it's called the Street Medicine Training, and we received that as well. And that will be something that our housing navigators and our medical director and our director of client services can all attend and really just become more familiar with what street medicine is and how we can safely provide services if we did decide to expand into providing street medicine. And then our fourth one is through Pacific Clinics, who really is in the lead of ECM and community supports here in the whole California region. But they are going to be doing our becoming a housing specialist for our community supports housing navigators. So that's kind of like an overview of the TA projects that we applied for. But just specifically for the CS project, our vendor is going to help us review and assess social support resources, coordination strategies with existing community-based organizations and best practices, come up with tracking systems for our social services, provide it to our members, and develop strategies to improve the delivery of our services overall. Also to obtain client feedback from surveys and develop workflows and key processes to better serve our members. Also to identify potential partners with whom we might not have met yet, to coordinate community-based services to expand our services for our members that we already have. As far as our ECM project, to develop formal best practice workflows and ECM services, to identify and address current staffing challenges. So with the PATH grant, we received funding to be able to hire more personnel. So we're going to be hiring 4 ECM lead care managers, and we've already hired 1 of those so far. And then 2 more housing navigators, and we've already identified those, and we will be hiring them at the beginning of the year. So we're really excited about that. So this all really just collaborates together and just makes us a much better program to provide services to these members. Also on the ECM one, it will also improve coordination and integration within our organization, because maybe Toby could better describe our process, because being a recovery campus, it's a one-stop shop for these members to be able to better themselves. Toby, do you want to speak a little bit on that?
Okay, can you hear me?
Yes.
Okay, yeah, so Visions of the Cross, we have residential inpatient for men and women. We have intensive outpatient treatment. We have transitional housing for men and women. We are able to get a lot of our clients as direct referrals from one of those programs. And we are working with several other agencies for direct referrals also throughout the community. That's how that process goes as of right now.
Perfect. Thank you. So like I said, it'll help us improve the integration within our organization for all of us to work better to serve our members and our ECM and community supports. Also to enhance our tracking and reporting and follow-up mechanisms for ECM as far as our referral services goes. Right now it's just on a spreadsheet. I'm sure there could be better ways. So that's why we're really, really excited to have these vendors, because it's like we already have an existing, 2 existing programs that are functioning wonderfully. But to say they're functioning at 100% would be a lie. So it's always great to get professional people for free of service, just by applying. I think I answered 3 or 4 questions to be able to receive this. And for each one, and it really, once you identify what your needs are as an organization, then you can really go into the marketplace and search through keywords, like what would better suit you in your organization, whether it's something that's already been off the shelf, where it's been already pre-planned for you, and you can kind of go in there and mess around with the measures and kind of change those around to better suit your organization's needs, or it's you already have identified what it is that you want, and you just need to find the vendor that will better suit your needs, and then you apply that way. So whatever best suits your organization's needs, I suggest you going for it. And if you have any questions at all, I'm more than welcome to help you all. Next page, please. Next slide. Okay, there we go.
Yeah, so I think we're really just what questions do folks have? I know when we did our in-person in October, there were a lot of initial questions, and so I'm wondering a couple months later whether folks have had time to kind of digest. I'm curious if anybody's gone to the TA marketplace and looked around, and what your experience was with that, what your reflections or questions are.
Yeah, I actually just wanted to follow up on exactly what Gabrielle was identifying right now. When we had the in-person session a couple of months back, there were virtually no stakeholders that stated that they had applied for support on the TA marketplace. Is it okay if we just do a temperature check to see if since that engagement, anyone has just taken the time to see if they wanted to apply on the marketplace by a show of hands? Or even using the chat to say we have applied or we haven't applied. It would be great to know who's in the room right now.
Got a quiet crew today. So like, it's almost the holiday to bomb.
I know, yeah, like it's almost the holidays.
We have max brain capacity for I know doing this in mid-December is
For
rough.
the year, brain max capacity for the entire year has
Yes.
been
Yeah,
Yes.
yeah. And I see that, let's see, we have access, just not as a vendor. So Dan, does that mean that you have access as a TA recipient? I think I saw the name Dan. Oh, Dan Coalition.
Dan Coalition. Yeah.
Yes. Does that mean that your team has access as a recipient to receive those services, like have applied to gain access? Nice. Okay. Any considerations on the domains just yet that you might be looking into, just to kind of do a temperature check? Because I know that coming into 2024, because there are so many organizations that have not tapped into these funds, we are really trying to encourage and like drive the utilization towards those towards those resources. Because like I stated earlier, these are resources that these teams deserve, like need and deserve. And so I see that, yes, they do have access as a TA recipient. I also see Trisha, it says that we have looked at the TA marketplace, but haven't utilized any services just yet. Trisha, I have actually, before I go
That
to
looks
that,
like you've got a raised hand from
yeah, I
the
see.
Coalition. But then, yes, Trisha, I'd love to hear kind of why that is, why you haven't applied for anything yet. But yeah, let's go to Dan Coalition.
And the person from the Coalition, feel more than free to unmute and share. We see you have your hand up. Oh, and I'm so sorry if you're speaking, we can't hear you. So we will circle back around. But please also feel more than free to use the chat. Oh no, we can't hear you. We're so sorry. Okay, yeah, let's just give it a couple of seconds to see if you can try to figure out that tech issue on that hand, or jump into the chat for us, and we'll circle back around to Trisha. We would definitely love to know if you are feeling more confident to be able to use the marketplace and what you're considering as a part of those domains.
Hi, I looked at it. It's actually been quite a while when we were looking at kind of some of the different database and tech type solutions that we're wanting to do for case management. We ended up going with just a different database company for all of our case management needs. So we didn't need that right then, but I think I'll go back and take a look again since we've been doing some more things. I think like the person from Visions of the Cross said, we haven't completely honed down exactly what our needs are yet. So I haven't applied for anything. I do kind of want to apply for PATH cited funding. Also, we haven't done that yet either. I did look at the application a while back and I wasn't sure if at that time what they were soliciting for didn't quite match our like target populations and stuff. So I'm gonna look at what the new funding is for this next round that's opening in January.
Great. Well, it's good to know that that circling back in January is on the radar. Oh, and it looks like Dan Coalition is coming back in. And I heard that from someone else, our Benson too, that circling back in January sounds like a good idea. I will warn you that at least for cited, you've only got 2 weeks in January. So if you are interested in cited, I would really recommend taking a look at that. But yeah, TA Marketplace is ongoing. So having that be something you do in the new year sounds like a great plan. And I see that our representative from Dan Coalition is back with us. So you want to try to unmute and see if you can come on?
Yes, maybe
Hi,
that's the
We can
trick.
hear you.
wonderful, we can hear you.
So we're kind of in a bit of an interesting situation in our region because we are switching managed care providers in the entire region. And we almost feel like we're starting over because what we contracted for now, they're asking us to prove that the program is viable. So we're not even sure if we're going to be a part of this future forward. When we signed up for the marketplace, it was basically just general networking, how to build your lists, all of that for outreach to the community. And now we're kind of in a holding pattern because we're kind of questioning, well, why would we be responsible for proving that a program is viable when we're just signing on as community supports? So we came forward thinking we were helping out, and now we're being put in a position of responsibility that we're not so sure that belongs to us. So we're not sure where we're at right now with the program, but we saw the marketplace as a way for us to be up to speed, stay connected, and really be more knowledgeable about this as a community-based organization. So that was our intent with the marketplace. Not sure where we're going now.
Interesting. So now, do I have this right that you're being asked by the MCP to prove the viability of your program?
That is correct.
Interesting. Okay. Okay.
That's what
Whereas
we
you had
thought.
already been contracted with a different MCP?
Correct. We were
Ah.
contracted with the 2 managed care plans that are no longer going to be in the region. So the care plan that's coming in has said to us, we'll give you a 6-month trial to prove that this is viable.
Got it.
And then we'll go from there. And we're saying, well, whether it's viable or not, this is a service that the community requires. And
Right.
in a rural region, why is it on us to prove viability for this program? That should be something you're either going to do it or you're not, just for community's sake. So we're not really sure where this is going to go. But to be honest, we had hesitated a year and a half ago to come in through this window because of this very question. It's a rural region, we're losing population, and we signed on for transition, nursing facility transition, because that's what we were asked to do. But do we have hundreds of transition cases a year? Of course not. It's a rural region. So we questioned the viability of it ourselves, and we took on great cost just putting this program together. Now it looks like it's possibly gonna crumble, to be honest, which is unfortunate because we're willing to stay, whether it's viable or not, just so that when it is required, it's there. So
Yeah.
we're not really sure what is the next steps here, but that's kind of where we're at. No fault finding, no finger pointing. That's just the reality of where we're at.
Yeah, thank you for sharing that experience. That sounds like a really tricky spot to be in. I'm wondering, Ashley, not to put you on the spot, but I'm wondering if you have any insight on, for those regions, transitioning, any insight on kind of how that's being managed with existing CS and ECM providers.
So I believe, if I'm piecing this together correctly, and please correct me if I have it wrong, but I think it's referring to community support services that are currently being offered in the counties where we don't have presence currently, and then the state's requirements of partnership once we enter those new counties, to provide those services for continuity of care. So, right now, partnership only offers 8 community support services, where some of the other managed care plans were offering additional ones. So I'm pretty sure that's what is being referred to, is the services that we were not providing, that we will continue for 6 months. And then at that 6-month range, that's where partnership will have to assess whether that needs to continue, if we're adding those services on, and so on and so forth. But I am not the community supports expert, so I don't want to misspeak on their process with expansion, but I think that's where that's coming from.
Great. Thank
You
for
are
that
right, spot
context.
on. That is exactly where that's coming from. But I think where we kind of stepped back was the reality that this was not our ballpark. We were asked to come forward by the managed care plans, and we went through. It took us a year and a half just to get the approval from the other 2 plans. Now those 2 plans are leaving. Another plan is coming in, and we're not even sure if we're going to be a part of this anymore after everything we went through to become a part of it, showing our vote of support. So again, there's no finger pointing or anything, but it just seems like in a rural region, if we don't step up to do these services, who's doing it? Nobody. Nobody. So I thought the whole point of CalAIM was to bring some resolution to these types of situations. If we're still back in that bandwagon where, you know, it's not financially viable, so we're going to drop it, I think that that didn't help at all for this region. That's just my soapbox. Nobody, like I said, no energy behind it. That's just the reality that we're in. Why are we not doing enhanced care management? Because as a center for independent living, the requirements of enhanced care management bring us into a social work window that we are not allowed to federally step into. We have to have permission from the California Department of Rehab, for example, to visit someone in their home. And before we can visit them in their home, we have to justify through our records that we've done everything possible to allow them the independence to come out to the service or come to us. So the whole concept of enhanced care management goes contrary to what we stand for as one of the 28 centers for independent living in the state. So we can't sacrifice one contract for another one. So we stayed in the community supports window, and now it looks like that window is also closing.
I'm curious, are there other community supports that you all currently offer or might get involved in?
We were specifically asked in this region to only apply for that one.
Got it.
So in the absence, and that was the managed care plans that asked that of us because no one else in the region touched it. And it's something that we do already under our current state level contracts with the Department of Rehabilitation. So they just said, why don't you just go for that since nobody else is doing it? In the absence of this program, honestly, we'd probably be going back to square one because the other elements that are here in our region are already covered by other agencies. And we have 9 counties to look after. So the last thing we look at is the addition of another program that's going to duplicate what's already being done.
Sure. Well, yeah, thank you for sharing that. It sounds like you're highlighting, I think what is likely an experience that others are likely having as we go through this Medi-Cal expansion and transition process next month. So thank you for putting this on our radar. And I think this is definitely
Of course. Yeah, I mean, we're here. We'd love to still stay with this and make this work for the community. We didn't come in because we felt it was viable. In fact, in our application, we put that right out in the application. We don't see this becoming viable. And we felt it was important to discuss what those options were long term. Now, a year and a half later, it's looking like we're back to what we presented at the very start of it, but we've just gone through a lot of work and effort and would love to stay in this process somehow.
Yeah.
We're just not sure what that somehow looks like at this point.
Yeah, thank you again. Ashley, I'm wondering, would you mind reaching out to Dan and putting them in touch with Chloe? Because I'm just thinking that, or you know, whoever might be the right community supports contact, just in terms of you know, getting some more follow up.
Yeah, and I know we only have 10 minutes, but I wanted to make 2 quick references because I do think that what was just uplifted is something that we actually have heard more recently as a part of the MCP transitions that are taking place. And what's coming to me right now is this reminder that CalAIM is still in its infancy. And when you have a program and an initiative of this size and scale, although there are very impactful health equity considerations and outcomes on the other side of this work and needed benefits and services as a part of this work, there are going to be so many challenges. And I know that, you know, the representative from Dan Coalition stated not pointing any fingers, and that's absolutely not how this messaging is received. These are incredibly important pain points that are being experienced. And this is the precise purpose of this space, is to be able to bring up exactly those challenges. And so as a part of, which we're going to get to later, the continuation of this work, a lot of stakeholders asked DHCS directly, hey, like what's going to happen in 2024? How do we continue to partner and network with our colleagues and our peers to bring up these challenges and identify solutions? And so I really appreciate the fact, because it takes a lot of courage and bravery to say, hey, this is what we're experiencing right now. And that's why this conversation is so important. And so we are absolutely chronicling this on the back end. But in addition to being able to get in contact with the appropriate person at partnership, we would love to have another conversation just to dive deeper and really juxtapose that to what other experiences are. And importantly, I would really love to hear from the rest of the group, verbally or via chat, what other community supports are needed in a region that might be scaling or are not currently being provided that is a need. And this question isn't to put the managed care plan like on any type of on the spot like whatsoever, for lack of better terms. Is really just to understand like what's the local pulse, like what do locals feel the needs are, just so we can also have this information, because there's a balancing that also takes place as a part of an initiative of this scale. There's so many stakeholders that come together, and we are really just trying to be a convener and facilitator of understanding what the actual need is and like how we actually reach that together. So sorry, that was a lot, but I wanted to validate that insight, which is incredible, and really just ask for that feedback in the chat as to, what else, is a need in this region so far as community supports are concerned that's not being provided currently. And sorry, I hadn't included the list of all of the community supports in lieu of the 4 that were not being provided, because that was just faster at this moment. And Gabrielle, I'll pass it back
Thank
to you.
you, Alexis. Thank you. And I'm actually going, because since we only have 5 more minutes, I'm going to move us forward because I think we have some important next steps for our next session. So first, so please put in the chat, a response to Alexis's question about, services that need to be bolstered or that are currently missing, particularly in the Northeast. Additionally, we'd love to know, as always, we always ask this question, what part of today was most valuable to you? So Gavin's presentation on IPP and cited funding, our discussion around TA Marketplace, or just generally the Q&A. So thank you for giving us some feedback there. It's been really helpful as we target these agendas to try to make them as valuable as possible. So I see them all coming in, so thank you. All right, wonderful, good. So it looks like people got value throughout, so that's wonderful. All right, let's go to the next slide. And just wanted to give you, for those of you that were here last session, a reminder, and for those of you that weren't, just to let you know, at our last session last week, we talked about these 6 levers, as DHCS is calling them, but they're really just 6 priority areas around ECM and CS that DHCS has identified for 2024. In January, so at our next session, our first session of next year, we're going to have what we hope is a pretty robust discussion with this group around questions that DHCS identified for each of those priority areas. So to prepare for that, if you'll allow me, I'd like to give you just the tiniest bit of homework, which is to look at those that slide deck again. It's linked in here, and we can also definitely send it out to anybody who didn't get it. And look through those questions that DHCS is posing to the collaborative groups, and think about, do you have input on this? I imagine that the folks on this call have a lot of valuable input on these questions. And this is really a chance for us to gather all of that input and send it straight to the state to inform their policy decisions. So if you have thoughts that you want to email us ahead of time, we would love that, because it'll help us frame the discussion. If not, just come prepared to share. And we really hope that you will all join us at the January session. Date and time is TBD, so we'll get back to you with that, but really hope to see you all at the next session so we can really talk through some of these important priority areas and the input that you all have. And we'll go next slide, please. And then just, so yeah, stay tuned for the date, time, and registration link for January's session. As always, if you want one-on-one help or with either process improvement or just maybe these funding questions, anything that would be helpful, please reach out to us. We love meeting with you one-on-one. Those are some of our favorite meetings. So. And then we also have office hours in January coming up as well. And with that, I just want to thank Andrea and Toby and Gavin again. Thank you so much. It's really helpful to hear from peers and real life experiences. And I will hand over to Eva to close us out.
Thanks, Gabrielle. Yeah, and just as always, a special thanks to our whole CPI project team, as well as Gabrielle for facilitating these robust CPI sessions. And thank you all for joining. We'll be sending out these slides after the session that have additional resources and all of the links, the aforementioned links. So thank you all so much. Happy holidays, and we'll see you soon.